The challenge and the opportunity of being a market leader is that the benchmark is yourself. For us as Boston Scientific, we're constantly challenging ourselves to advance, and TENACIO was an opportunity to do that.
The question that we were trying to solve for was, how do we make this product easier for patients to use? It's an implantable device, but it's completely dependent upon the patient's ability to make it work. So there is a burden on the urologist to be able to make sure that the patient knows how to use it, to identify, where do I squeeze to inflate it? Where do I squeeze to deflate it? How do I hold the pump? How do I make it easier for them to squeeze the pump over and over to reach an erection that's satisfactory for having intercourse? And so, those were the types of questions that we were after. That's a high bar.
The challenge for us as engineers was, how do we quantify that? How do we determine what easier is to such a large and varying population of people that are going to be using this device?
Developing a new product in the medical device arena is not a small endeavor. As such, we went to the patients themselves, interviewing hundreds of patients. From the outside, you'll notice that the grip and the grip configuration has changed. The grips have been designed to, the patients are aligning their grip and their fingers into the spot of the pump that will allow for maximum efficiency of their pumping. There's also more of a neck between the pump bulb and what we call the valve block. And then internally, the valving system, much more simplified.
We know the device will perform from an efficiency standpoint in terms of moving fluid from the reservoir to the cylinders. It's going to work 27% more efficiently. The momentary squeeze MS pump was a significant innovation, but it was 18 years ago, and technology has changed, our manufacturing capabilities have changed. And what I want people to know when they hear about TENACIO is that this pump was designed from the ground up. And then within the device, the liquid injection molding technology that we've invested in over the last few years enabled us to actually build the design that the R&D team came up with.
What we're able to do with liquid silicone rubbers is they're actually more flowable on the molding side of things. And so it allows us to mold some geometries that had never been possible before. And so we've been able to kind of really step up the manufacturability on the device itself.
TENACIO is a really important step forward. It's purposely designed, purposely built with the patient experience in mind.
TENACIO is just another example of Boston Scientific being on the cutting edge, being on the leading edge of device investment, patient investment, manufacturing investment. All those things I think are tremendously important. We take a lot of pride in continuing to invest in changing the pace and accelerating the pace of innovation.